Go for it. Okay. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, Mass General Law, Chapter 30A, Section 18, and the Governor's March 23rd, 2020 emergency order imposing strict limitations on the number of people that may gather in one place, the Board of Health meeting will be conducted via remote participation by the board. The meeting will be live streamed by Westwood Media Center, and the public can view the meeting by accessing the link. Our government channels will be broadcasting the meeting on Comcast Channel 12 and Verizon Channel 42. The public is encouraged to watch our meeting via the Westwood Media Center live stream. The public will be allowed to make comments if they wish to do so during the portion of the meeting designated for public comment by using the chat function. The chair will continue to give guidance and instructions as needed. Every effort will be made to ensure that the public can adequately access the proceedings via technological means. In the event that we are unable to do so, despite our best efforts, we will post on the town website, www.townhall.westwood.ma.us, an audio or video recording or transcript as soon as practicable after the meeting. Okay.
So be it. So let's call the meeting to order. I guess we're already recording the meeting, so I don't think we have to worry about that. We'll go to the minutes of the last meeting, which was December 15, 2020. Has anyone any comments or corrections to make about those minutes? Hearing none, do I hear a motion to accept those minutes?
Make a motion to accept.
Second?
Carol, you're muted.
I second it.
All right. All those in favor signify by raising their hand. Or I guess we have to say aye, do we not?
Yeah.
All right.
Aye.
And I as well. So that's the three of us on the board.
So you got to each record your, I know it's been a while, sorry. You have to affirm by stating your name along with your vote. So Roger, you can call on Shelley or call on Carol and they can vote, but we have to make sure that it's.
All right.
All right, does that make sense?
Does Shelley?
Okay.
How do you vote?
Yes.
All right. Carol?
Yes.
And I vote in the affirmative as well, Roger Christian. Having completed that, we go then to Margaret's public health nurse report, please.
Right. So as you know, it's mostly COVID related these days, which I know Jared will do the update on that. Beyond that, I am continuing to follow one positive case of tuberculosis that we have in town that I reported last month, or last time we met, was no longer infectious, but per state guidelines, we are required to continue to monitor medication administration. Going terrific. The case continues to show great results, following up with medical care. Nothing worrisome in that direction. No other cases to report in terms of tuberculosis. One additional case since we last met of Campylobacter, again, a bacterial disease, typically causes diarrhea, tends not to occur in clusters, one of the world's most common causes of food poisoning or diarrhea. And again, an isolated case. No one else in that family was reported to have been ill sharing the same foods, probably related to food preparation, which is also a big cause of it, typically poultry, but can also be water related, not cleaning your hands, not cleaning your cutting board after you prepare meat and use vegetables on it afterwards. So the recommendation is to have 2 separate cutting boards. Can also be from unpasteurized milk, unsanitary water. Those are other causes, but again, very common in the United States and much of Europe. And just again, an isolated case within the household, doing well and nothing else really to report.
Good. Any questions? I do have one question. Margaret, do you have any face-to-face Meetings with any, I guess you'd say clients or patients?
Yes, the one person case that I do have face-to-face meetings with would be the administration, the tuberculosis case. I am required to monitor medication, and that does involve face-to-face encounters, both in-home and via WebEx, a Zoom-like encounter. Because of the pandemic, we've sort of cut down on face-to-face, but we are doing it. Yes, I can see the monitoring, if you will, via video camera. So yes.
So even in this country, we have observed medication administration,
Yes, yes, absolutely.
right?
Yes, and the case has been diligent. I don't like to say compliant. I feel like that's a bad word to use with someone, but extremely diligent and motivated to get through the process, which can take several months, perhaps about 6 months to complete medication. So again, it's been nice to make the community connection, and case is progressing in a positive way.
Good, thank
Yeah.
you.
Sure, thank you.
Any other questions? All right, shall we then go on to your report, please?
All right, thanks. It's nice to be with you all again. Happy New Year. A little bit belated. So just to touch on where we are currently in terms of our COVID numbers, the weekly report that came out on the 4th, which was last Thursday, has us back as a red designation for our color-coded, designated symbol. So we were yellow for 1 week, so we were red, and then we flipped yellow the week prior to last, and then this week we flipped back to red. And our case counts have been pretty consistent. What flipped us back and forth this time was the percent positivity, which had dropped below 5% down to like 4.87 on the report from 2 weeks ago, and then this week it just touched 5.0 right on the button, which pushed us back into red. So, I've said a million times during the different conversations we've had, the color coding is just, an optical representation. And, whether we're yellow because we're 4.99% or we're red because we're 5%, the fact is we're still seeing, a pretty hearty amount of new cases being reported. In January alone, we recorded 299 out of our 800 total cases. So, we're all buoyed by the fact that the state is reporting cases are dropping. We're not necessarily seeing that yet. We did have a decline of about 17 cases 2 weeks ago, which was, maybe about a 8% or so decline, which was, it was something. But the following week, it ticked right back up to around 197, I think it was, for a 2-week total. So this past week we were at 192, and I believe right now we're tracking at 190, and we still have 4 days to go in the counting cycle for the data that'll be reported, not this Thursday, but the following Thursday. So, Westwood is not out of the woods yet, and I know vaccine is coming along, which I'll talk about a little bit later. But we really need to reinforce to the people that maybe feel like things are easier or better. We need to remain vigilant. We need to remain steadfast in our distancing and our masking and our hand washing and our own personal, monitoring of our own health and the health of our families. Not attending unnecessary gatherings or overcrowded places. All of those things are still so important for us. Household spread still, is around 75%, meaning that if you are positive inside of a household, other members of your household have a pretty good chance of getting infected. And I would say in Westwood, that's our story. We're seeing 1, 3, 4 people under one address, testing positive for COVID. So it's definitely, we're still in the thick of it, and I'm hoping that we're trailing and our cases will start to decline, similar to maybe what other communities are seeing. But, we look at the data, we look at the age breakdown, we look at the demographic, and, the age range is skewing younger, but it's been skewing younger for a little bit. but it's still a wide range from, 3 years old to 83. So we're still seeing a community sort of impact throughout. We thought maybe we would see more for sports or more for school, more for restaurants and, the holiday season. And, obviously travel's coming with the holiday or the winter recess coming too. So, similar to what we had talked about before the holiday break, was that if people are going to be heading out of town for the winter recess to go, somewhere else, to go skiing or to go to somewhere sunny and warm, they need to follow, the governor's travel order so that they can get tested, within 72 hours of their return, and they should self-isolate until they get their test result. And it's important that they comply with the COVID, because if we see another uptick, we're going to be no better off than we were a month ago, which is staggering considering how heavy the cases were coming in. So the other thing I wanted to touch on, there's a lot in the news with the variants, the COVID variants. They were called the mutant strains, and now there's sort of 3 predominant ones that are getting a lot of attention, and there's a couple ones that are maybe a little bit more sort of just trickling up from the surface. The UK and the South Africa and the Brazil strains, which we've been on calls and the state doesn't really want us to identify them geographically, because there isn't necessarily an association, I guess, with the places where they were identified. They just happen to be identified in those areas. But there are 1 or 2 others. They're talking about these being more highly transmissible. We don't know if they're more highly virulent, in that they're going to produce more symptoms or worse symptoms in presentation, or we don't know if they're going to be indicated with a higher mortality rate or higher ICU rate. Typically what we've always been trained as is that as a virus becomes more transmissible, it becomes less lethal. As it goes through, which is the common cold, quote unquote, is ubiquitous, because it's just a very sort of low to moderate level of infection, and that's what allows it to spread so easily, because you can still go about your life while you're sick. So the state is screening for those 3 variants, and if there is a variant detected in someone in our population, they will notify us. So you'll be notified that the variant is present. As of now, there have been a few identified throughout the Commonwealth, but it hasn't been widely identified. But almost a year ago to this meeting, we sat here and said the same thing about SARS-CoV-2. And within, I think, 4 hours after we signed off on that meeting, we had indication that we had our first positive COVID case. So, as with everything with COVID, we're constantly learning, and we're constantly being sort of outpaced by the veracity of this virus. So we'll keep tracking it, and as the new things develop, you'll be updated. On a lighter note, this Monday, what's today, Wednesday? I don't even know anymore. Tuesday. This Monday, the governor, his latest order on occupancy was reinstated back to the 40% capacity for most businesses. So that, that goes for pretty much all the ones that were temporarily reduced during the winter surge down to the 25% back to 40. So that's, your retail stores, your grocery stores, your auto dealerships, places like that. Personal services, like all of those things are expected to still comply with all the COVID rules, but they are allowed to increase their capacity back to the 40% rate. We do get a fair amount of complaints from the grocery stores. The grocery store occupancies are astronomically high. I think Wegmans is now up to about 1,500, Jason, they're allowed to have?
Yeah, by letter of the law, if they operate at capacity limit, that's like 1,400 people for them.
Right. So, one of the things we get a lot of calls go, oh my God, there's so many people in there. We think it's more bottlenecking and, in certain areas of the store where people tend to be congregating, because, we saw it at Easter and then Thanksgiving. Everybody's buying the same things, and then everybody's trying to get to the checkout. So some stores tend to have tighter spaces up by the checkout, which gives the resident or the shopper the idea that there's just it's just a free for all. We've done a few investigations over the pandemic in each of the grocery stores, and I don't want to say they've been perfect, but I would say on balance they've been pretty consistent, good actors in that regard. To transition, I don't know, do you have any questions right now about where we stand in terms of our COVID metrics to date? No? All right, well, let's talk vaccination. So last week we, with the Council on Aging and Westwood Fire, we successfully operated our first residents only vaccination clinic. What a unbelievable undertaking. Started with Lorraine and Margaret and Chief Deckers and me and Lena. Jason helped, and we got the whole place set up. Jimmy McCarthy and his people over at DPW. Everybody sort of came in to help get this thing off the ground. We had to order some supplies last minute, and we were able to stage the site, and we've got volunteers from Town Hall, and we've got volunteers over at we've got Nora, and we've got Tiana and Karen over across the hall who are helping to call residents who are 75 and over who may not have access to email to help them request and then schedule appointments. We've really seen a tremendous input from all of our coworkers across most departments, and it's really been great to be able to rely on people. I know we have some volunteers, but volunteers require a little bit more, care at this point, because they're not really allowed to come to the building and be trained and then work through whatever task we're going to ask of them. So one of the main sticking points we talked about early was making sure if we're reaching out to residents, we're calling from Town and Westwood identifiable phone lines, because scams, obviously we're hearing things, these scams are already out there. So we wanted to make sure that our folks who were calling to help, collect personal information from our seniors who want to get their COVID vaccine, have it says Town of Westwood on it, and when they pick up the phone, they can at least verify. And if there's any seniors out there watching it, if you get a call from somebody who purports to be from the town and they don't have the Town of Westwood on the caller ID, take their name and number, politely say, I'll call you back when I can verify you are who you say you are. We're not going to be offended. We carry badges and IDs, as health officers. And I always say, if I go into a restaurant and the person doesn't recognize me, it's not offending me if you ask me for my identification. I'd rather you did that than, let someone in who has no business being here. So that's been a nice help to have extra hands. So we're appreciative. So we're planning supply is really our biggest impediment right now. So the state is restricting local boards of health to 100 doses per week. That was told to us at least through the end of February, that was all we should expect of the Moderna, which is what we're using. So we start with what we have. We have created a system where residents can go online to the website, westwoodma.gov, and request their appointment. In that field of that Google form, Donna at IT created, people put their information, name, birthday, age, category they fit into, address, phone number, email. That gets sent to a master sheet, which then gets charted as appointments come available, as vaccine gets shipped. We can then invite 100 more people to sign up for the next clinic. And as we get another 100 doses, we can invite 100 more people to sign up. So that's the system that we started last week. So hopefully once we get into a rhythm of 2 or 3 weeks, we then have to counter our first doses or at our first dose clinic with our second dose clinic. So then, once we get to that point, then we'll be in a pretty good rhythm. I think probably mid to late March we'll be there. We'll be putting through, probably close to 200 a week, which would be a combination of first dose, second dose. So it's going to be busy for what we're capable of handling, but we're also hoping and expecting other sites to come on. Gillette, obviously, Fenway. There's the TripAdvisor site in Needham are all up and running, for eligible residents. Wegmans is now up and running on a limited basis. CVS, I know in Medfield is up and running. So as more and more providers come online, the access to appointments will increase and people will be able to kind of get a spot much more quickly. And we've said this from the beginning, they'll be able to get a spot much more quickly at a high throughput site than they will at the Westwood Senior Center, which is just it's just the math. It's not for our lack of want to, it's just the supply and it's just the configuration of the space. I mean, thousands of appointments per day at Gillette versus, the 100 per week that we're able to offer. So, we're here for our residents who need us. We're going to encourage everybody who can get to Gillette, to get to Gillette or to the TripAdvisor site in Needham. That'll free up more of our limited number of spaces for those who truly have mobility or transportation or any other issue, which would make them less inclined to be able to get, from the parking area at Gillette into the building and up the escalator and through. That's a little bit more high tech, I guess, than what we're doing, but we're seeing still pretty high demand, at least in this phase. And we would expect that to continue moving into additional phases, and we have side sort of plans for teachers and maybe, and DPW and those folks when they're eligible and vaccine is readily in supply, we can pull those people out on a side clinic and also do that too, which may be a good opportunity for some of our volunteers to chip in also. So I'm very happy with how we're going so far, although I don't want to, pop the champagne just yet. It's only been 1 week. But I think, with us and fire and COA working together, having volunteers from all other town departments chip in and, DPW making sure that the ice melt is all spread out on the sidewalks and that the facility is set up the way we need it to be COVID safe. I would say that the residents of Westwood should be very pleased with what we were able to pull together. So any questions about vaccine?
Yeah, sounds very good. One other facility that is beginning to reach out is Partners or Mass General Brigham. I was told that I could go in for mine there.
Okay.
So I think they're beginning to look at their aged population and.
Well, they couldn't have got your name out from that, Miss Roger. Come on.
I heard
that-
the site was very organized, that it's
What was that?
I heard that the partners site, when they reach out to you, is very organized. I have a friend whose parents did it and their information was pre-populated and you put in your zip code. And this was a couple who lives in Wellesley and they were directed to it's, I think, 1st or 2nd Street in Needham, which must be the TripAdvisor.
That's the TripAdvisor site, right?
I'm thinking. So I do think that Partners is doing a good job with that.
And I got an appointment down at Gillette, went down there last week and found that extremely well run. They even had someone tell me which button to push when I got on the elevator to leave.
I agree with you, Roger. I went to Gillette as well. And literally the needle was in my arm 5 minutes from walking in the door. And so, Jared, I was really happy to see that in your newsletter, you encouraged residents to consider that site if they're at all able to get there it's, they probably could get a vaccine, several weeks before waiting for the town, which is again, nice for people with mobility issues. I also wanted to ask if there, and I haven't seen this anywhere really in the state except for one town I saw in the news. Do you think there will be able to deliver them to people's homes for people who, because I do Meals on Wheels, and I do have some people that I can't see maybe even getting out to the senior center. I'm not sure.
Yeah, we, Margaret and Chief Deckers and I and Michael Crawford, oh, sorry, forgot to mention Michael Crawford, our EMT paramedic. He's been vaccinating pretty much almost everybody. So Michael Crawford at Westwood Fire, he's been phenomenal. I feel bad forgetting to mention him on the front end, but he's been great too. So yeah, we're trying to make sure that we have our own pieces. I'm sorry, I'm in a little brain fog. Can you repeat your question? I got distracted on the Michael Crawford part.
Yeah, I was just wondering about people who are homebound, if there's.
Oh, yeah. Okay, so we did have a meeting. Yeah, sorry. We did have a meeting. There was a CDC document that was put out on how to sort of create a mobile type of scenario. And we are going to be doing that. We wanted to do it soon. I know I have a few folks who call me regularly and are anxious to get on the list. Logistically, it's a little tricky because, you're not supposed to drive around with the thawed vaccine too much. So we have to make sure we have, a stable transportation mechanism, and we have to make sure we have, at least 10, have the 10-person sort of route that we're going to try to implement so that we can make sure we're not going to waste vaccine that way. And then we also have to have an inoculator, or a vaccinator, plus we need to have somebody sort of hang behind.
Yeah.
And do the observation piece. And with some of these folks, it might be a 30-minute observation as opposed to a 15.
Yes.
So like these logistics make it a little challenging, but we have heard that there's visiting nurses and other associations and regular, regular care nurses who are doing home visits to these eligible folks are also able to maybe do some of this stuff too. One of our other residents had called me and said that it was either through the MGH folks or through partners. They actually had a nurse come to the house, and one member of the household got vaccinated and the other one didn't. So the other one needed a spot on our list. So that was, so that was good to hear. So, the long answer is we're efforting to get there. We just have to make sure we're doing it right and doing it safely. We were hoping to have that done by the end of the month, at least with, the people who are sort of in that list. But we also, we need to have a system that we can verify that, those folks are homebound. We have a short list, I think, of people that we maintain for emergency purposes. But, if they don't volunteer themselves to us, then we're not aware of them. So there will be maybe more outreach in another week or two to see how many folks actually are out there. I know of 3. I would venture to guess there's probably a handful more that we don't know about.
That's great. Thank you. It sounds like the plan is really going well.
So far, so good, I guess.
That's great.
Right.
Yeah.
I don't know if is there anyone in the audience, Erica, that has questions?
I'm not seeing any.
Okay. So the only other thing I really wanted to touch on, which is coming up a lot lately, and I think will be coming up much more forcefully in a few weeks, is sort of what the Board of Health role is in the return to school discussion. So I just wanted to kind of go, we've been in communication with the school department pretty much since the pandemic started. It's important for us to be there, to offer guidance and, information and regulatory sort of, information and opinion on what the different rules are that are coming out. And there's a lot of, a lot of discussion on, 6 feet versus 3 feet. This is in every town in the Commonwealth, probably every town in the country. There are groups of people who are saying, this has been going on forever. The 6 feet is just, it's, keeping all these kids home. They should be in school. There's a balance here. There's a mental health component. There's a socio emotional component. There's learning gap. There's slippage. There's all of these negative externalities that are associated with this prolonged sort of, hybrid model where we're not back in school full-time, 3 feet, all that. So, there's a lot of studies coming out. There's a lot of news coming out. We do have a working group that is here. I am a participant on. I think the most important thing for us to make sure that the community understands is that we don't make policy for the public schools. Public schools make policy. They can offer their policy to us for review and to make sure it's compliant with the regulations or with best practices. But the school committee is the body within the town structure that decides what attendance or what model they will be in. So, we're constantly reading, studying, learning, talking to other towns, trying to get the best information that we can have in formulating our opinions on how safe everything is, how safe a school is, how safe a restaurant is, how safe an office is, whether a dentist is a physical therapist. We've been doing this, every week since this started. It seems to be reaching a fevered pitch here with school. There hasn't been a lot of notable transmission inside the school. That may be as a result of 6 feet. That may be just luck. And maybe that people didn't get tested or got tested at the wrong time. It's very difficult in the moment to really get a clear understanding of that. It seems as if there is success in keeping transmission out of the schools at 6 feet. The counter argument is, why not stay at 6 feet? So this is becoming a very complex issue for all of us. And I have a lot of different stakeholders reaching out, and they're on both sides of the argument, frankly. And so I just wanted to kind of start to put that out there as an issue that probably will be coming up, at the next meeting, or the meeting after that. The CDC, with the new administration taking over, a new head of the CDC, it's being rumored that new CDC sort of regulations or best practices or guidance will be issued in coming weeks. And once that's done, if they change things dramatically, we'll have the opportunity to opine on that. I think one of the hangups is still that we are at 6 feet in terms of contact tracing. The straight up definition of close contact from the CDC, 15 minutes within 24 hours, within 6 feet, whether you're wearing a mask or not. So if we're going to place kids in a room at 3 feet, the list of close contacts is going to be exponentially larger, which would then, create larger quarantine numbers when there is a case inside of a classroom of a child who, so there's sort of pros and cons in both. So I'm hopeful that CDC can sort of step up and take the lead on this and use all of the research and all of the, all of the information that they have at their disposal to come out with a comprehensive revised plan that we can all coalesce around and move on with some safety protocols in place and some comfort and security that if the school department does make changes and, if we move in a direction that would encourage more people to come back into the building, that it will be done so safely. So, that is probably going to be the biggest issue that we're going to be looking at, aside from just case reduction and rolling out vaccine. Hopefully when the spring, I know I talked to the superintendent a few months ago, and, I had looked at April vacation, the post-April vacation, as being a time where we could start to think about widening the offerings, because we would be able to use outdoor space to sort of accommodate that distancing. So more to come, but if you have thoughts on it too, please feel free to share them with us at, when you feel like it, whether in a meeting or you can always, contact me outside individually and we can discuss it. But so that was I just wanted to touch on it because I know it's a concern and we're all concerned. I mean, we see both sides of this and we see the community struggling as what to, where to fall on this with our students, being that this is now the 11th month of the pandemic and, seems like everybody feels like something needs to give. So hopefully the CDC can provide that piece of science that will allow everything to sort of fall into place. But so I guess that's all I kind of have on my radar for right now. Anybody else has anything?
No?
No?
Well, hearing nothing more, do I hear a motion to adjourn the meeting?
I motion to adjourn the meeting.
Carol Ahern, okay.
Carol.
Any second?
Second it.
Shelley Reaver seconds. All those in favor signify by saying aye. I, Roger Christian.
Aye. Carol Ahern.
I, Shelley Reaver.
Thank you. So we'll wait to see how things go and look forward to our next meeting, and hopefully things will have improved and we have nice information. Thank you, everyone. Good to see you.
Thank you all.
All right.
Thank
you.
Thanks, everyone.
Everyone.
Bye-bye.